Carolyn, thanks very much for making the time available. I really appreciate it. I look forward to getting to know all about your project so I can share it with my readers. I'll confess that I don't know anything about the project, so I'm looking forward to learning about it through you. Why don't we start with a kind of general question? I mean, what can you tell me about it?
Yes, I'm happy to tell you more. So the project is about this drug called Glix-13, and we gave it to individuals with OCD, and we asked them their symptom ratings using the Y-box, the Hamilton Depression Scale, and we found that it was very helpful for OCD, and it was incredibly exciting. Sorry, I didn't talk about what obsessive compulsive disorder is. So
yes, please.
So obsessive compulsive disorder is called OCD, and it involves intrusive thoughts that enter the mind and cause anxiety, and repetitive behaviors that then decrease anxiety. And I'm sorry, I didn't say what Glix-13 was. So that's also called Repastinel. Oh, and Y-box is Yale Brown Obsessive Compulsive Scale.
Okay. Why did you decide to take on work like this?
Well, as a clinician, I see a lot of patients, and they need help, and this is one way that I thought to help. Yeah, it's a good question. Let me just give it some more thought.
When you say help people, you mean people with OCD, right?
That's correct. Yes.
Is that a big problem? I mean, do a lot of people have that?
Yes, around 2% of the U.S. population have obsessive compulsive disorder, and it really impacts their lives.
2%? That doesn't actually sound like a whole lot. Is it really that serious a problem?
Yes.
Okay, so what were you hoping to accomplish through your research?
We were hoping to help individuals not suffer with OCD. And what we wanted to do was test this new compound, Glix-13, which acts on glutamate. And glutamate is a neurotransmitter in the brain. And this drug changes levels. And we wanted to test it, and so we did an open label trial with a 5 to 7 minute push of Repastinel, and we asked the patients their symptoms. We also collected vital signs, O2 sat, blood pressure, and we found that it was very well tolerated.
Okay, so who was behind the work? Who funded it and supported it along the way?
Yes, so the funders were Brain and Behavior Research Foundation and the Robert Wood Johnson Foundation.
Okay, so how has it gone? What's gone well? What hasn't gone so well?
Well, one thing that has gone well is that it's been nice to identify rapid-acting treatments for OCD. One thing that didn't go well was that we had to stop in the middle because the pharmaceutical company purchased the compound. And then we had to stop the study, and they are now doing phase 3 randomized trial.
Were you even able to finish the research?
We just had to stop. We just stopped with a smaller sample. I wish we could have kept going, but what can you do when there's a cease and desist?
Okay, almost done. So, if people could only remember one thing about your project, what would you want that to be?
stumped me. That Rapastinel Glix 13, that works quickly.
Okay. Great. Is there anything else I haven't asked you about or that you'd like to share with our readers about the work?
I don't think so.
Okay. Well, great. Thanks very much. I appreciate your time.
Thank you.